Okay, I think we'll get started. It's just 6:02. I want to welcome everyone to the School of Professional Studies Graduate Nursing Degree Info Session. The School of Professional Studies is part of the City University of New York system. Okay, my name's Linda Paradiso. I am an assistant professor at the school. I'm also the coordinator of the Nursing Organizational Leadership Program track. So we will talk a little bit about each of the three tracks that we have as we go along tonight. Dr. Margaret Riley is our academic nursing director for all three programs. So the School of Professional Studies has three graduate nursing programs where you earn a Master of Science in Nursing. I know many people think of it as an MSN, but it's actually a Master of Science in Nursing, so it's an MS. And we have three tracks, a Master's in Nursing Education, Nursing Informatics, and then Nursing Organizational Leadership. And we're going to talk about each of those in detail. All three of those programs also have an advanced certificate option. So for instance, if you have a graduate degree in another field and another nursing field, like an NP, and you'd like to get some nursing education, a graduate degree, a graduate certificate in nursing education, you can come to the school and you get what is called a postmaster's advanced certificate. So, and you could also do that if you decide you'd like to go into nursing informatics and you'd like to sort of minor or so in nursing education, you would get an advanced certificate in nursing education. So you can do any three of the programs as an advanced certificate option. So why do you think you should earn a master's degree? There's many different reasons, but most of them are because as nurses, we are really, it's really important for us to enhance our professional knowledge as lifelong learners. We want to develop the advanced practice leadership skills that are really important in the hospital setting or any healthcare setting. And as a master's prepared nurse, you have many employment opportunities. If a door opens, you have the credentials to walk through it. So let's think about some of the reasons why as well. So in 2010, the Institute of Medicine and Robert Wood Johnson Foundation partnered with the American Nurses Association to examine the transition and changes needed for the nursing profession. And they produced a report called The Future of Nursing. And the key recommendations were that nurses should be able to practice to the full extent of their educational training. So in other words, we often call that working to the top of your license. To achieve higher levels of education, in particular, a bachelor's degree as minimum requirements for education. And as you know, in New York, in 2018, that was passed, and any nurse who graduates from a program after 2018 must earn a BS in nursing within 10 years. Be a full partner in redesigning the healthcare field in the United States. And also implement, they needed to implement an information infrastructure and data collection so we can share information and be involved in policymaking. A number of the healthcare organizations around the country are also seeking magnet status. And magnet status is the highest level quality indicator for hospitals to achieve that demonstrate that they have a commitment to quality and safety outcomes. 100% of nurse leaders in a magnet facility must have a BSN or master's degree. And 100% of nurse managers must have a BS or master's degree. As of 2020, 80% of the registered nurses who work there have to be on their way to obtain a degree in nursing. So that's a big ask for many facilities. And as you know, it's about 1% of all hospitals across the country who do get magnet designated status. Another reason why a master's degree is really important is the Affordable Care Act. With the implementation of the Affordable Care Act, some people call it Obamacare, but the name of it is the Affordable Care Act. Millions of people were added to the insurance system, and it really changed how healthcare was delivered. We changed from a fee-for-service to a value-based performance program for hospital reimbursement and healthcare reimbursement. There are more than 2 million nurses in the country, and as direct caregivers, we are really in a really good position to integrate this level of care with the interprofessional care team and provide direct access to healthcare for patients, families, and communities. So when we really improve our educational level, we're building on the knowledge and skills needed to contribute to this effort and provide patient-centered care. There's also a really great emphasis on health coaching and health promotion and disease prevention for reimbursement, and that's really changed a lot of the way we drive care. We're changing from illness to prevention model. And nurses are really, that's our forte, being educators. So we're really, it's really important that we be key players in the health prevention and disease prevention promotion of the Affordable Care Act. So now that we've discussed why you need to go back to school, let's figure out what you should look at when you decide to enroll. So first of all, the program offerings, we have the 3 tracks that I spoke to. We have 3 types of programs or nursing programs in the city. We have the CUNY system, the City University system. We have the SUNY system, the State University system, and then we have private schools. We want to think about location when you choose a school. Where is it located? How long will it take to get there? Is it close to where I work or where I live? Does it have only on-site program? Is it online? Is it hybrid? What are the kinds of learning styles? Face-to-face is the traditional classroom style learning, or online has 2 different kinds of styles, synchronous and asynchronous. In a synchronous situation, everyone would be logging on at the same time and learning together. In an asynchronous situation, people learn at their own pace. You do have deadlines. I'm not saying that you don't, but you will be learning at your own pace. So you want to think about what works best for you. Is it a traditional style? Is it a blend of styles? Do you have to go to campus or not? Lots of people are choosing online formats. And as you know, our school is a fully online school. Part of the requirements of our school also is that you will have to complete a specific number of clinical requirements in your specialty, and we will talk about that as we go along. We also have we provide clinical placement assistance, and we also admit twice a year, spring and fall, which is not as common in other schools. So part of the CUNY outcomes is that we really focus on communication. We focus on leadership strategies because safe and quality care is really paramount in nursing. We engage in interprofessional care collaboration. So that means that you'll be doing some of your learning with other professionals from other fields. It's sometimes in simulation and sometimes on site. We really design our courses to address the global, and population health concerns of our community. We are using all kinds of technology to support safe practice environments, and we really think about that in each of the courses as well. We implement care management across disciplines. We analyze research and implement evidence-based care in our courses. We're looking at organization and financial structures of the healthcare delivery systems. We want to make sure that the models that we decide that are best practice really have a financial foundation in healthcare delivery system. And we're integrating the nursing with other sciences, and nursing is an art and a science, so we are integrating nursing with other required courses and for your healthcare outcomes. Okay, we are part of the City University of New York. Our actual brick and mortar campus is at 119 West 31st Street in the city. We have a beautiful building there with classrooms and all kinds of meeting spaces. We are accredited by Middle States Commission on Higher Education. We are also accredited by the New York State Education Department and the Office of the Professions. And finally, we are accredited by the Collegiate Colleges of Nursing Education, which is, we just were reaccredited for our graduate degrees. We were accredited for the RN to BS program, and we just became accredited for the graduate programs as well. And this is a real high achievement. And although a lot of people don't realize this, it is a requirement of nursing programs in the state to be accredited by some national nursing organization. Our students are just like you and me. We're working adults. Many may be in a career transition. We may wear many hats. We are parents, we are spouses, we are partners, we are siblings, we are caregivers at work. We have family life, we have fun life, we have all of that. And students will find that an online program really fits their schedule. We are associated with the Baruch Library. So that's where we have our 24-hour library access, as well as all other CUNY libraries through interoffice loan and access through the libraries, the online library system. If it were in person and you wanted to go to the library, you would go to the Baruch College Library. We have a help desk with tech support. We offer tutoring online and on campus. We offer career services, and we offer mental health counseling. At SPS, our nursing program, we also have some unique learning opportunities. In our, for example, in our advanced practice health assessment course, we build on the skills you already have. So we utilize Shadow Health, which is a digital, you take care of virtual patients in a digital format. You also have the opportunity to participate in some leadership opportunities, such as Sigma Theta Tau, which is the Nursing Honor Society. And we have a Nurse Leader Speakers Series, and we've done several we've done several series focusing on the professions, and recently we did one on self-care, the importance of self-care. If you want to get a better idea of what online class is like, you can go to the School of Professional Studies website and follow this link to an online learning platform for an example of what the classes will be like. Typically, all our classes are asynchronous, which means you will be learning at your own pace throughout the week. You can expect to spend about 8 or so hours per week in work, between answering assignment questions and doing your research and reading. So about 8 to 10 hours per week per course. Time management is really the key to success, and we have some abilities to help you with that. We have small classes. Many schools where you take online courses, sometimes you have 30 or 40 students in an online course. Ours are limited to 20 at the max, and sometimes it's much lower than that. My last class, I only had 8 students in, so you can see that sometimes it's higher and sometimes it's lower. But the 20 students is the maximum. You're engaged with an instructor. We spend a lot of time working with students throughout the week, even if it isn't in asynchronous format. We are engaged with our students a lot. On the first day of class, we introduce each other to ourselves. Sometimes it's through a video link, and sometimes it's through just talking about yourself in a discussion forum. We will review the syllabus and make sure you have your contract to know what you need to do to get a good grade. You'll have some lecture work, homework, readings and discussions. You'll be able to ask questions. You'll have some quizzes and midterms and papers and exams. It's just like a traditional classroom. The only difference is that you are communicating online instead of in a classroom, in an actual classroom. So remember, you must have a computer, and it will be using a mobile device or a tablet is really not going to be able to work, because you need to have high-speed internet connection. You need to be able to utilize search engines, and typically a laptop or a desktop computer are the only ways you'll be able to do that with ease. So some things to think about is how comfortable you are working on a computer, and how comfortable you are being able to dedicate about 8 to 10 hours of time per week to each of your courses. So some time management tips. You want to prioritize your activities, and your instructor will pretty much be able to help you with that. You'll be able to have a very good idea of when, for the entire semester, when everything is due, and you will have access to all the work at the beginning of the semester. So you can sometimes do work ahead of time if you're finding that one week you have more time to devote to your coursework than others. So you can plan your time that way. It's really important to utilize the calendar so you can see everything for our 15-week semester. You need to have some Wi-Fi. We do use Blackboard as our learning management system. So you will have to become familiar with how to access Blackboard, as well as Zoom and other technology. But mostly, I would say the big ticket items are Blackboard and Zoom. And we do have, like I said, tech support for both of those things. So this is what a typical sign-on looks like when you start a course. This is our Advanced Practice Health Assessment course, one of the first ones you would probably take as a graduate nurse. And this would be your home page. And as you notice on the left-hand side, you have different sections where you will find information. And then as you click on each one of these sections, you'll be able to find the information you're looking for. Announcements that your course instructor will provide to you will be under the announcements tab. How to contact that instructor is under the instructor information tab. Your syllabus and all your contracts are in the course information. Then you have your weekly materials set up as a week-by-week framework for the 15-week semester. You have places to submit your assignments under the assignment tab. your weekly discussion forum where we correspond with each other as students and instructor together is in the discussion board. So these are a few of the areas where you can, and this is what looks like a typical week, week by week. I had showed you, if you noticed before here, we talked about the weekly materials tab. This is what you would see when you click on weekly materials. Week 1, an overview of what the content is. Week 2, the same thing for every single one of the weeks. And then as you click on each area, it will take you directly to the content that you would need for those weeks and how to submit all your assignments. So how much is it going to cost me? That's a really big, important question. CUNY tuition is very affordable. We have the lowest tuition in the city. It's lower than the state tuition, and of course, it's lower than the private sector. If for graduate, our tuition is $470 per credit, and it sounds like a lot. But if you look at what it costs in some private schools, sometimes you're paying almost $2,000 a credit. So for a full-time student, it's $5,545 a semester. Even if you are out of state, you would be charged in-state rates. So I know one of my students is from Texas this semester, and she's paying the same tuition that someone who lives in New York is paying. So if you live in New Jersey, if you live in Connecticut, you can access our school because it's online, and you will be charged in-state rates, which is a big deal because if you went to an out-of-state school, sometimes they're charging you out-of-state rates. It depends on the school. Even if it's a state school and you access the school out of state, you get charged a much higher rate than anyone who lives inside the state. You also can qualify for financial aid for some of the degrees, and that would be something that you would speak to a counselor about as you're thinking. If you're thinking about this school, we could hook you up with a counselor to talk about your specific situation. Each master's degree will be 45 credits for completion. Each of the master's degree, nursing education, informatics, and organizational leadership. If you choose to apply for an advanced certificate degree, if you already have a master's degree in nursing in a different field, and you are applying for an advanced certificate post-master's degree, that would be 18 credits. And it would be just taking the core specialty courses, and all of them are for postmaster's degrees. So that means you must already have a master's degree. If you go to our website, you'll be able to see all the application deadlines. The master's degree is 9 core courses, which is 27 credits. Everyone takes those 9 core courses. And then there are 4 specialty courses in your selected track, which is 15 credits. Each one of the tracks does include 135 hours of a practicum, which is your capstone course, a 6-credit course. And it also includes a graduate elective course. So in total, you come out with 45 credits. If you're only taking the advanced certificate postmaster's courses, you would only take the specialty courses, 15 credits, with the 135-hour practicum and a graduate elective. So it is 18 credits versus 45 credits. But remember, that's for someone with a master's degree. These are our core courses. So you would be taking a policy and a nursing 600 course, policy and ethics. It explores nursing and public policy formation in relation to healthcare system and organizations. It really frames healthcare financing, practice regulation, access, safety, and quality. Nursing 601 is about nursing theory and role development. It's the science of nursing, the development of nursing theory, and the development of the professional role. Nursing 602, healthcare finance and management, is basic financial and accounting concepts related to healthcare management. Additionally, we'll go over some regulatory standards that involve third-party reimbursement and insurance issues and the impact of the Affordable Care Act. Nursing 611, Advanced Practice Health Assessment, builds upon your basic health assessment skills. It includes also research on human development, anticipatory guidance, prevention and early detection of risk factors in disease. So prevention is emphasized. And there's an overview of population care management, so population health. In Nursing 612, Advanced Practice Pathophysiology, we're going to go in depth on case analysis of risk factors, the changes, the pathophysiological changes of the body, and the associated clusters and of signs and symptoms of illness will be explored. Nursing 613, Advanced Practice Pharmacology, focuses on applying pharmacotherapeutics to the management of health and illness in populations at risk for morbidity and mortality. So there's an emphasis on the synthesis of how the pharmacological medications that we take and what it does, and how it acts on the body. And it also, there's a focus on prevention and treatment of acute and chronic illnesses. Nursing 615, Advanced Nursing Informatics, will explore the current trends and issues in using, designing, and managing data within healthcare systems or academic settings. So it's really about how we use information systems and technology to evaluate the outcomes of care, the programs of care, and how those outcomes inform how we change, right? How we change our practice, how it informs quality improvement. Nursing 625 is statistics for advanced practice nurses. And this is about conducting nursing research. So there's an emphasis on evidence-based practice, quality improvement, and the use of aggregate data. So you'll be really figuring out the common statistical analysis used in nursing research studies. And then Nursing 626, which is advanced nursing research, will be all about conducting nursing research with how to, the pros and cons of using different research approaches, exploring the different data collection methods. So it builds on 625. Okay, then we have our 3 tracks, the nursing education track, the informatics track, and the nursing organizational leadership track. And I'm going to go through each of those separately, as well as your certificate courses separately. So for your master's and advanced certificate practicums, there is a practicum for all tracks. There is a 135-hour practicum. You can have self-placement. Many of our students do their practicum where they work, and that's highly encouraged because you often can perform a quality improvement project and see the outcomes, and that really gives you some good satisfaction. Or we can help you with nursing placement if necessary. So the nursing education master's track. These are the things that we really will be focusing on for that track. We're going to focus on curriculum development, how to develop curriculum in a changing healthcare system, how to adapt educational strategies for diverse types of learners, adult learners, visual learners, audio learners, all different kinds of educational strategies. We will develop and implement evaluation, measurement, and testing outcomes and strategies. And you will be learn to lead and manage accreditation process, because every nursing program has to be accredited. So you'll learn how to focus on preparing national and state standards so that you can measure the outcomes of your program. And of course, we're going to prepare the future nursing workforce. So you'll be qualified to serve as an educator in a college, major university, academic health centers and hospitals, community-based health facilities, and then you'll be able to pursue doctoral education and potentially sit for your certification exam, certified nurse educator. As a nursing organizational leadership track student, you will develop and explore leadership skills and strategies to promote quality patient outcomes. You will advocate and mentor the professional nurse as a member and leader of an interprofessional team. So you'll be, a real focus is on that interprofessional collaboration. You will design a nursing organization business plan utilizing budget, cost benefit analysis, and marketing principles. So we'll really get into the nitty gritty of finance and systems analysis. And then we will analyze how policies impact the structure and financing of healthcare, nursing organizations, and health outcomes. Graduates will serve as directors of nursing. You'll have the background to be a chief nursing officer, an entry-level nurse manager. You will be all kinds of directors in different kinds of organizations. As a student in the Master's in Nursing Informatics track, you'll be able to analyze institutional data needs. So we will really discuss and focus on data analysis and application of that analysis. You will be able to utilize technology to design and implement plans to manage patient data effectively. And you will be able to manage data efficiently to enhance quality and safety in care delivery. So graduates from the informatics track will be able to serve as a clinical informatics specialist, an informatics nurse specialist, clinical applications coordinator, and then sit for the informatics nursing certification exam sponsored by the American Nurses Credentialing Center, the ANCC. So how do I get into SPS? What's the admission criteria? You need a bachelor's degree in nursing from an accredited school. So it does not have to be in New York, but a bachelor's degree in nursing. You need a GPA of 3.0 or better. You need to have an RN license and be actively registered. You will prepare an admission essay. You will need 2 letters of recommendation, one from a nursing faculty member or a nurse educator, and one from a nursing supervisor or manager. You will share an evidence-based practice project that you may have completed either at work or in school, and you will need a resume. You'll also need to submit your transcripts from your baccalaureate program. The evidence-based project, people typically have a lot of questions about. It will be a capstone, it can be a capstone project or a quality improvement initiative at your facility, such as, you know, how we've improved fall prevention on our unit, how we implemented a pain management policy, how we changed a restraint policy, or we improved outcomes to decrease use of restraints on a unit. So what we're looking for in your evidence-based practice summary is that you discuss and describe the evidence that supported the use of the policy and include some references on how you developed how you looked at the literature to identify why this was an important project. We also want you to describe your role in the project. And you have the ability to go to the SPS website, and you can find all the information that I just talked about in the Apply Now application tab. So you can register to create an account if you're not a previous CUNY student. We do have, many of our students are CUNY students from one of our various baccalaureate programs. But if you are not, you just have to register for a new account. So the application process for advanced certificates is pretty much the same, but you're going to apply for an advanced certificate instead of a master's program. And it's the same CUNY website, the sps.cuny.edu website, but you're going to select certificate instead of master's program. And the same thing, if you do not have a CUNY First account, you will register if you're a new student. And this is what that process looks like. You will, this is for the master's degree. This is what the screen will look like. You will create an account, you will put in a username, and you will develop a password. So one of the things that is really important to remember is that we're in a world that's constantly shifting, and it happens, you know, and will you be prepared as things move along? You'll all be getting this slide deck. So I think I'm going to try and devote some time to questions and answers if there are any, instead of sharing the video with you about Shift. But you will be given the link for this in the slide deck when you receive it, and you can go on to YouTube and watch it. So for more information, you can feel free to contact sps.cuny.edu/nursing. You can call us at 212-652-CUNY, or you can check out our Facebook page, CUNY SPS Nursing. So at this point, I'm going to check out our Q&A. If you have not asked a question through the Q&A, please do so. I'm going to, and Darian, maybe we can also open, can we unmute everyone in case they have questions that they'd like to share? Doesn't seem to be too many people.
If they can raise their hand, I don't want to unmute everyone at once.
Okay.
But we have a Brian Keene.
Right. So if you could unmute Brian, so we can get a question from Brian Keene.
Got it. Brian, I'm going to unmute you now.
Okay, Brian, what is your question?
Great, thank you. And thank you for the overview of the programs. I was just curious as to what you can speak on regarding acquiring the MS in nursing, and specifically immediately after graduation. This is a newer program and a newer school, as I understand it.
Mm-hmm.
And I'm specifically interested in the organizational leadership track.
Okay. So are you saying that you are a new baccalaureate graduate? Is that what you're saying?
I am. I pursued a career change, and I graduated with my BSN in August of 2019, started clinical nursing in November of 2019 as well. And so I've been a staff nurse for a little over a year.
Okay. Well, I have to say that there are a lot of nurses who are choosing to complete their graduate degree as a novice nurse, and it is not unusual. Before I became a professor at the school, I was a nurse leader in various organizations for more than 30 years. And for me, having that master's degree demonstrated the internal motivation of a candidate. I don't know that you really need to be it depends on your specialty, of course, but there are many tracks in healthcare that you can go into without a lot of medical experience or nursing hands-on experience. I think a graduate degree, it would just bolster your credentials. And especially as a second degree, I think that you would be in, oftentimes we have more mature, and I say mature meaning age, more mature students. So a second degree is not unusual. And therefore going and getting your graduate degree quickly is pretty common.
Great, thank you.
You're welcome. Any other questions? Sonia King? Okay, so I'm gonna go to the question and answer, and then we'll go back to Sonia. So there's a question here. Can you speak about the accelerated BSN Master's Program? So that is a specific program for nurses without bachelor's degrees. And this program that I'm speaking about tonight is for nurses with a bachelor's degree. So we will be offering a webinar on the baccalaureate program and the accelerated baccalaureate program. Unfortunately, I do not remember the date of that, but if you go on the website, you can find that information, or you can leave your email in the chat box and I can send it to you. The next question, I'm a current student in RN to BS program. I'm taking nursing 301 and 302 right now. Am I eligible to apply? And you are not, sadly. You need to have your baccalaureate degree to apply to graduate school. Are there alternatives for letters of recommendation? What if we can't get a nurse educator to write us a recommendation? So if you're working, you can get a educator in the clinical setting, or from a past school setting, you can also get like a faculty member to write a recommendation. If you can't get either of those types of people to write a letter for you, then what I would suggest is you contact us and we talk about your situation specifically and see how we can make that individualized change for you. But right now we're looking for a educational type of letter and a managerial or supervisory type of letter. Okay, so you're doing your BSN with SPS. Is it the same process for application? So you must graduate with your BS before you apply to the graduate program. So you won't be able to apply until you're in your last semester, and graduation is pretty much imminent. Is there a minimum number of classes you take per semester to be considered part-time? You can take one class a semester, or you can take more than that. So the minimum number is one class per semester. Most of our students, I would say, take 2 or 3 classes. Each class is 3 credits, except for your final class, which is your capstone course, which is 6 credits. And we suggest that you take that one alone. So you can take 1 class a semester, which would be 3 credits, or you can take more than that. Someone getting a master's degree from CUNY can also get an advanced certificate. I'm a bit confused. So if you're getting a master's degree in, say, organizational leadership, you can, after you graduate, you can come back to SPS and get an advanced certificate in one of our other tracks. Suppose you decide that you would like to really be more of an expert in informatics, because you feel that as a nurse leader, you really have to rely on data a lot, and you want to have a better understanding of quality indicators, data management, different kinds of data and analysis. You could come back as a graduate postgraduate degree. It has to be postgraduate, and you can get an advanced certificate in that. So it's sort of like a second specialty to a graduate degree, but you already have a master's degree. I'm an NP looking to transition into the informatics track. Is the advanced certificate program appropriate? Probably it is, because as an NP, you already have a master's degree. So that's a perfect scenario where you would want a advanced certificate versus another graduate degree. You don't have to then take all those core courses again, which you probably have already taken in your NP program. So that's an excellent example for when you would want an advanced certificate program. I'm pursuing an MS in organizational leadership at SPS currently. Can I use my project practicum from this program as the project requirement to apply to the certificate program? Absolutely, yes, you can. And I'm not even sure it's required for an advanced certificate, so I would have to check that out for you and get back to you, Maria. But it would be an excellent example of an evidence-based practical, an evidence-based practice project. So absolutely, yes. Let's see if we have any more questions. We'll look in the chat box. Okay, I see Tunisa's asking for, Brian, you can absolutely use your EBP from your nurse residency program. That's a perfect fit. Absolutely, yes. Okay. So let me see if we have any more questions in the Q&A. Yes, so I'm a current student in the RN to BS program at CUNY SPS. I saw in the student handbook that students who are currently enrolled can opt to apply to the accelerated program after completing 301 and 302. So that is not the case anymore. That may be very true. I am not an expert in the accelerated program. So if that's what you see in the handbook, I would say that that's most likely more accurate than what I've told you. So if you want to contact me directly, I'm going to put my email in the chat box, and I can make sure that that's correct. Or you can also contact Dr. Riley, the program director, but I would say that your handbook is probably more correct than I am.
Hi, was Sonia able to raise her hand, or was she able to talk? Sonia, I'm not sure if you want to talk or not. I could let you.
Okay, let me just see if I saw Sonia's question. I did not see a question from Sonia, so I don't, if Sonia's still on, you can unmute her.
I'll just unmute you. Okay, so I'm going to unmute you now, Sonia.
Sonia, do you have a question? Sonia?
It doesn't look like her hand was raised either.
Okay.
Maybe.
I also did see a question from a student who said that she's not currently working, which is not a problem. I've actually found that there are several students in the graduate program who are not working. It's typically better if you do have some experience, but I don't think it's prohibitive. So I don't. Go ahead.
And also, I think you might have addressed this already. Tunisia had sent in her contact information about information for the RN and BSN
Yes.
to MSN program. Okay, you might have addressed that already. Sorry.
And it looks like she's an SPS student.
Okay, great. And I think she asked later, what would a person do if they're not working as a nurse? I think you
Yeah.
might have answered that
Yeah,
as well.
yes.
Sorry.
Okay. Any other questions? Let's see here. Is there an approximate percentage of students who get accepted into the program overall? If you meet the eligibility requirements, Lisa, we pretty much will accept everyone. We don't limit our enrollment each semester. We do have admissions in the spring and the fall. If you meet the eligibility requirements that I spoke about, then pretty much you will be accepted into the program. Okay. So I think I have answered everything I see. If I get accepted, but I'm not able to start in the fall, yes, you can defer it once. You can defer your admission. But remember, we do admit twice a year. So you want to make sure that you can start if you can, but you can defer an admission if you have not started classes once. Let's see, more chat questions maybe. Here's Sonia again.
Okay, I can unmute her now. Okay, we'll give it a try. I'm now unmuting.
So Sonia, are you there? Sonia, you can use your capstone project as your evidence-based practicum project example for graduate studies. Many of our baccalaureate students do use their capstone as their EBP example. So if you're hearing me, yes, you can. So there really is no difference, Brian, in an MS in nursing and an MSN. The state of New York does not have an MSN. Some other states actually have masters in nursing. We have a Master of Science in Nursing, and it's really pretty much the same. It's the same degree. It's just different wording. Just like you have a Bachelor of Science in Nursing. You don't actually, your bachelor's degree, if you look at it, does not say Bachelor's in Nursing. It says Bachelor of Science. You're welcome. Okay. Anybody else have a question? If not, I'm going to say thank you for joining us. We're going to pull this video webinar together, and we are going to send it to all of you via email. You can feel free to forward it to anyone else that you think may be interested in the program. You can go on our website at any time, and there are direct links to all of our emails, and you can email us at any time if you have questions. Dr. Riley is very available as well as our program director. You'll find her contact information on the website as well. And I hope that everyone has a good evening and that you all stay safe, especially if you're working in the healthcare system. Yes, you can speak to an advisor. We have an advisor for each of the tracks. I am the advisor for the Nursing Organizational Leadership track. Dr. Lily Matthew is the program advisor for Nursing Informatics. And Dr. Bartley Daniele is the program advisor for Nursing Education. So once you apply to the school, you can, you will be paired up with one of the advisors based upon the track that you're interested in. If you want to just speak with someone about which track to choose, you can always reach me. I'm going to put my email right here now. And my email is very easy to remember. It's linda.paradiso@cuny.edu. And you can feel free to email me, and I can point you in the right direction if I can't answer the questions. If there are no other questions, please stay safe and be well. Remember to practice some self-care every day. Bye-bye.
All right, I'm ending. Have a good one.
Thank you. You too. Thank you.
No problem.